On Sunday, September 22, 2024, Kenya was struck by the tragic news of the passing of Dr. Desree Moraa Obwogi, a young medical officer intern. Dr. Moraa, just 27 years old, died by suicide after her 36-hour shift of intense pressure and overwork in her position at Gatundu Level 5, where she had only worked for 4 weeks after transferring from Nakuru Level 5.
And officers from this station went to the scene, which is around 600 meters from the station, in an apartment within Gatundu town. And we established that there was a lady aged 27 years, about 27 years, who had committed suicide.
Kenya Medical Practitioners, Pharmacists, and Dentists Union, KMPDU, has once again called for reforms.
We've always been talking about shortages of doctors in the hospital. The hospital does not have adequate number of medical officers. Even the pharmacists are not adequate, even the dentists. And it's not just a shortage, but acute shortage. You know, we are changing, the country is changing, and everybody would want to. The generations we are raising is not the same as generations that were there before. Harassment during ward rounds has been a thing that has been there persistently. And we are not encouraging it. If anything, we are hoping and we are going to talk to our members to make sure that they make the interns as comfortable as possible, but still make them learn as much as they're expected to learn. Early enough, even in school, cane used to be used, but we have moved away from the cane. We are using other methods, so we're also encouraging our senior doctors to use better methods to communicate to the interns in acceptable language.
Though her life was cut tragically short, her death may finally push for the changes that so many have been fighting for. The question now remains, will Kenya's healthcare system learn from this tragedy, or are we still waiting on others?